The Senate health care bill unveiled today is a repudiation of nearly every promise the president made to the American public about his approach to the health care system. No cuts to Medicaid, very explicit on that, lower premiums and deductibles, and insurance coverage for everyone.
I'm not going to cut Social Security like every other Republican, and I'm not going to cut Medicare or Medicaid. Save Medicare, Medicaid, and Social Security without cuts. Have to do it. We're going to have a health care that is far less expensive and far better. Yes, premiums will be coming down. Yes, deductibles will be coming down. Everybody's got to be covered. This is an un-Republican thing for me to say. I am going to take care of everybody. I don't care if it costs me votes or not. Everybody's going to be taken care of much better than they're taken care of now. You know, I've been talking about a plan with heart. I said, add some money to it. A plan with heart.
Strictly speaking, the bill doesn't even fulfill the president's promise to repeal the Affordable Care Act. It merely amends the ACA. In an off-camera briefing today, the deputy White House press secretary was asked specifically about the president's Medicaid promise.
So if cutting Medicaid was wrong when he was a candidate, why is it right in the new Republican Senate bill?
I don't believe that the president has specifically weighed in that it's right to cut Medicaid.
Does the president still believe, as he did as a candidate, that there should be no cuts to Medicaid?
I haven't had a specific conversation to see if there is an update to that, but I do know that he wants to protect that as much as possible.
But there has been an update to the president's position on Medicaid. The new position is, I like cutting Medicaid so much, I'm going to throw a party in the Rose Garden with House Republicans on TV in front of the whole country while we all watched. And if there was still any doubt, the president just tweeted, I am very supportive of the Senate health care bill. I'm joined now by Ezra Klein, editor-in-chief of Vox.com. Ezra, this was your summation. Senate bill, GOP health bill, in one sentence, poor people pay more for worse insurance. I find the bait and switch here pretty remarkable, given the way that the president separated himself in the primary and the promises that he made.
This is a really bad day in American politics. It isn't supposed to work like this. There is this line that you're hearing when you talk to Republicans about this bill. Got to pass it because what they promised to do is repeal and replace Obamacare. They got to keep their promise. They made a promise to people, and you heard it when you played Trump there, but also Mitch McConnell and Paul Ryan and all the others. They understood what people didn't like about Obamacare. They didn't like that it left a lot of people uncovered. Mitch McConnell on Face the Nation said it left 25 million people uncovered, and he's right. They didn't like the deductibles were so high, premiums were too high, co-pays were too high. People ended up in insurance they couldn't afford to use. So they told people they would repeal and replace Obamacare with something that fixed these problems.
Right.
And this makes every single one of those problems worse, every single one. Higher deductibles, higher premiums on an apples-to-apples comparison for insurance, higher copays, fewer people covered. You're supposed to be able to trust that people basically want to go in the direction they told you. Maybe they exaggerate. Maybe they're saying it's going to do more than they say. Well, but the basic direction. But that's not what this is at all. They said they would go one way, and they're going the exact opposite way.
You know, part of this too comes back to this sort of the distributional impact of the Medicaid cuts. And I was in West Virginia and McDowell County, where 48% of people are on the Medicaid expansion there. And Paul Ryan said this thing. I want to play this for you because to me this is such a tell about what the agenda is here when you're talking about what they said they would do and what they're actually doing. Take a listen to this.
So Medicaid, sending it back to the states, capping its growth rate. We've been dreaming of this since I've been around, since you and I were drinking at a keg. You know,
I was thinking about something else. He was thinking about reforming Medicaid.
I was. I've been thinking about this for a long time.
I mean, to me, that shows you in some ways what this is.
But a lot was getting elided in that particular discussion. There are states that have refused to expand Medicaid by choice because they don't want poor people to have that health insurance. If they expanded Medicaid, those folks would get better health insurance. Now, if you move all the people who could get Medicaid onto these private plans, and particularly onto the much cheaper plans this bill is envisioning, what they get is health insurance that is much worse. They have to pay quite a bit more for. On page 5 of the bill, there is this piece that people are not going to report that much on because it's complicated, but it's really important. What it does is the Affordable Care Act ties subsidies to health insurance plans that cover 70% of your costs. This bill moves that down to 58%. A plan that covers 58% of your costs, you're looking at about a $7,000 deductible. So that, if you wanted to just encapsulate the plan in one move, it is that you move from health insurance that actually covers things to health insurance with about a $7,000 or more deductible. And subsidies, that is all you can get it for. It's a really, really profound change.
And that what's key there is that the insurance companies have basically sat on the sidelines. They've been essentially ostensibly publicly neutral on this. And part of what's insidious, I think, about this, which you're pointing to, is this sort of shoves a lot of money towards the insurance companies to sort of keep them neutral, as I understand the structure.
Oh, and it's worse than that. So if you look at the Affordable Care Act, the way they keep insurance markets stable is the individual mandate. They try to pull healthy people into the insurance markets. In this iteration of the bill, there is nothing that even replaces the individual mandate, right? They zero out the individual mandate. The House bill had something called continuous coverage. Probably wouldn't have worked, but at least was a shot at replacing it. This has nothing. And so I asked people, how are you going to keep insurance markets stable? And they've got this multi-$100 billion fund that they're just going to hand insurers money. You heard some Republicans calling it an insurance bailout. It's not a bailout. It's a payoff. It's a payoff for participating in the markets and not fleeing them.
All right, Ezra Klein, thank you for breaking that down. I really appreciate it.
Thank you.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.